because that's more important to you, and I'm just here for you guys tonight. So I decided to do RHOP ever since, I don't know, we're all little kids and like, oh, we want to be a doctor, we want to be a dentist, whatever. So at 18, I decided to do RHOP, sign on, and go through Chadron State. I've always known I'd like rural Nebraska, I've always wanted to go back to rural Nebraska, and that's kind of still where I'm at today. So you start and you do RHOP, and they kind of throw you in and start teaching you more about medical, because they're gearing you towards medical school or dentistry or whatever section you're in. And they're like, here's where things are at. We start visiting UNMC, we start talking to people who've been in the profession, we start shadowing, we start seeing what healthcare is all about. And my guess is most of you have shadowed some in whatever prospective field you want to go in. Because if you don't shadow, you don't know any more than what you hear other people say, or maybe your parents or your friend's dad works somewhere or whatever. That's the only way you know unless you go out in the field. And then you kind of get to med school. And one thing about med school is you hear about it, but you will never know what the experience is until you're actually there. You get there and it's kind of a culture shock. You guys are all at UNK. You're in small town Kearney, like it's a lot bigger than Chadron, but still small town. You get somewhere like Omaha and you're kind of thrown into like this big area. You don't know where anything is. You don't know, I mean, heck, I got lost walking campus and I live 4 blocks away. Just things that you just never think about or experience. And then you get into school and you're like, hey, I was in college, I did great in college, things were fine. Like, you know, I put my time in, but I still had tons of time to go home and see my family 5 hours away in Caro, you know, once a month if I wanted to, or spend all weekend with my friends. But you actually get to a certain point where you're like in med school and your life revolves around it. I don't know much about nursing school, I don't know much about dental school, but you get to a certain point where like literally your whole life is invested to this career. So you spend all night studying, you spend most of the weekend studying, you take a test every couple of weeks, and then you're like, oh, instead of going out with my friends, all I want to do is sleep all weekend because I've just been cramming all week. So life is a lot different. In the first 2 years of med school, the way they do it is it's all book work. So you're pretty much sitting there, you're going to class for, I mean, they've changed the curriculum since I went through now, but you go to class for 6-8 hours a day, I think now, and then you have to do some shadowing on the side. You have extracurricular activities a lot of people get involved in. There's student-run clinics we have, and you're juggling all this plus trying to have a life of your own. So that bookwork stuff, you're really not getting out and experiencing much of actual medical school and things you're going to be doing in your future. You're not seeing that many clinic patients. You're learning about kind of just like basic science knowledge and just getting a good feel for your step 1. During that time though, the med school does a good job of integrating things that they call like ICE, as well as we have like IPE day where we all meet with like people from pharmacy school, nursing school, there's typically OT, PT, and we all get together and we work through cases. One of the last ones we do our second year is literally actually taking a patient, and what we did is we worked through it from perspectives from the medical field, from the nursing field, from PT, OT, and what they thought about it and what they would do, and then what we would do. And you kind of learn really quickly that without all these components, none of you can fully do your job. You can't fully help a patient and you can't fully be there. So, you know, you've learned that experience in this simulated case and you're like, okay, now I just want to go home because I got a test in 2 days and I want to study. You know, you're just like, whatever. But you actually like think about it now that I'm on rotations and I'm like, you know, that was actually a very valuable experience. Because when I've been on these rotations, you know, I started on psych, or psychiatry. And with psychiatry, like, we talked a little to nurses, but it was mostly kind of like, you know, you'd see an inpatient and you'd work through their problems, and it was mostly you and the doctor, and there really wasn't lab or x-ray or PT or OT you were working with. It was really just kind of like you and that patient working through things, and maybe community service type things. It's getting them set up when they left inpatient. But then you hit OB, and on obstetrics, you're delivering babies. There is no way you're going to be able to deliver a baby properly without a big nurse to help you. They're there, they're watching the strips, they're helping you keep track of things, they're running through what's going on in mom's head for you and keeping her calm, and heaven forbid, some of those dads are even way more stressed than moms. But it's just kind of one of those things. So as I'm building, I'm learning, okay, now like, here's the nurse's role. And without them, like, I would be lost as a med student. There's one day I literally followed the nurse around most of the time. I spent pretty much the whole time in a room with her and a pushing mother. And that was a very valuable experience for me, because it's like, you know what? I wouldn't have seen this behind closed doors if this nurse wouldn't have taken the time to let me do this with her. Like, because I'm more in the way than anything. I don't know really what's going on. I've read it in a book, but I've never actually been in that experience. But she was there and she was talking me through it, and she didn't have to, but she did. And it became very clear to me that without them, it'd be really hard to deliver a baby. Then you get into like, I hit internal. And internal medicine is very, very complicated on so many levels. You see very complicated patients, very sick patients. And on inpatient, that is when you really learn that you need everybody involved. You have lab, which, you know, you're waiting on the lab, you have a really sick guy that just come in, and you need to know what his blood work looks like. I mean, I don't know how much you guys know about actual, try not to get too medical terms here, but you know, you want to make sure that he's got enough hemoglobin, so he's not anemic, and that he's not acidotic and gonna be really sick here soon, and you know, you want to make sure their oxygen saturation's good, and you don't need to put them on oxygen, and you're trying to work through all of that. And the nurses are there taking all their vitals and helping draw the blood, and labs working it through. Well, one of the great things anymore is you have computer-based systems. So as a med student, most of the stuff that we do is we sit there and we literally wait for our patients' labs to come back, and we tell the residents as soon as they do. So they're not sitting there doing that as well, they're working up everything else. Or we're calling labs to be like, hey, do you have the blood cultures back on this patient? And that's kind of your job as a med student, but you learn that you have to be able to work with these different people, as well as pharmacy. I've learned very quickly that even though I learned a lot about pharm as a second year med student, I really don't know as much as I would like to think I did, as well as I can just see the gaps of knowledge in the future. Like, there are so many new medications that come out. There's so many different names for the same drug, because you have a generic name and you have the brand name, and you can get confused very fast. But the pharmacist knows what's going on. And you can always call them about dosages, drug interactions, you know, hey, I have a patient that's like this, which class of drug or class of antihypertensive do you think would be best? You really have to rely on those people to make sure patients get the best care, as well as the pharmacist is looking over the orders you have. And they're sitting there seeing that, you know, these drugs are this way, and when a patient's gonna get discharged from the hospital, they're gonna catch things like, oh, they shouldn't be going home on this, but you're sending it home because you just forgot to discontinue that order. There's a lot of things like that, as well as PT, OT, especially inpatient in a hospital setting. You know, physical therapy, occupational therapy is a really key component. They go in and they're going to be the ones who are making sure that patient's getting up and walking, you know, for DVT prophylaxis or anything like that. They're going to be the ones who are going to be sitting there with the patient every day, making sure that when they do go home, if they're going home alone or with somebody who's not physically able to take care of them, that they're able to do things like go to the bathroom by themselves and get dressed in the morning and be able to safely get in and out of bed, which are things that, like, you're not going to think about when you're trying to make sure this person who's got a 200 over 110 blood pressure is coming down and they're okay. That's not something that, like, you're going to sit there and think about without that OT PT consult. So there's just some things like that where you really think about it, and the more you're on rotations, the more you see. You know, you need those x-ray techs. They're the ones who are going to be like, I can't take an x-ray. I can kind of read one at this point in my career, but I definitely can't take one. So you kind of get to this point where it's like, you know, you have to work with these other people, and without working with these other people, that patient isn't going to get your best care. You know, the nurses are on the floor one thing you do learn is that you can go talk to the nurse and they're going to tell you everything plus some that you need to know about a patient overnight or during the day, or if the patient's like, yeah, I couldn't eat that much. Then you go ask the nurse and like, oh my gosh, they ate 100% today. You're like, okay. So you kind of like learn these little things to where it's like, okay, without asking and communicating with other people in the profession, you really can't get as good of an idea of what's actually going on with the patient and being able to give your best care to a patient. As a med student, I really don't do much. I'm kind of there, I'm learning. I will speak with the doctors, I'll speak with the residents, give them my ideas. You know, I will do a physical exam on a patient. I will talk with a patient, get a history. But at this point, it's more about me learning as well, but also the thing about a med student is you spend so much more time with a patient that we really do help the residents and the doctors sometimes, because we find out those weird little things about a patient that most people wouldn't know. You sit there and you ask questions and you find out, oh, he actually fell 2 weeks ago and hit his head. That's probably why he's still a little confused. But he didn't tell you that because he came in because he burned his arm on the stove. You know what I mean? Just things like that where people don't always connect the dots from past things, but if you sit there and you really take the time to listen or put the whole story together, you really understand what's going on. I mean, I don't really have much more to say. Is there any questions we can go with, or things that you guys want to know about med school? Or, yeah.
Can you talk a little bit about like the application process and like how you went about like your personal statement, especially like how you started it, I guess?
I'm really, really sorry, but I didn't write a personal statement for med school.
Oh, I
So RHOP is a program where I actually wrote a personal statement in high school and got it, basically. And so on our applications, we didn't have to write the personal statement. We basically filled out the information, paid the fee, put in a code, and that's all we had to do. So I don't know. I know a lot of people, they say if you do a real kind of like more of a personal side, like I'm starting to think about my residency personal statement. And so I'm trying to think of like a situation in my life that I can put to it to like make it seem more like, you know, I learned this and this and this and this is how I went about it type. That's pretty much all I got.
That's okay.
But make sure you spend plenty of time and have people read over personal statements, because I've heard a lot of people who just kind of submitted one and didn't really spend a lot of time on it, and it's actually a little more important than you think.
So for RHOP, did you also have to do the interview process?
I didn't.
So what are your next steps following your graduation?
So after graduation, I'm currently in the process of trying to apply for what they call the primary care program or the accelerated program at UNMC. And both of those you can go into family practice with, and you start your 4th year actually in residency. And so either way, if I get that or if I do the regular match, my plan is to do family med and come back to rural Nebraska.
What's been your favorite rotation so far?
I really like family med. And the reason why I like it is it's not, you know, an internal, we did like inpatient and then outpatient, and OB-GYN is very, you know. And so everything is very specific, and I like the fact that I see like everything. So I start the morning and I go around on patients at the hospital, and then I go over to clinic, and there might be some procedures that we might be doing, or I might get to go watch a scope being done. And so it's very, there's multiple different aspects to it, and not one day is the same, except it seems like every day is the flu right now. So it's mostly flu, but there are some other things to it.
Did you have a good idea of what you wanted to go into specifically before you got to med school, or did it kind of change once you got there?
When I went to med school, I was dead set that I was going to do internal med. And I would have bet you money I was going to come out an internist. But now I'm kind of looking more into it, more of the kind of place I want to live, where I want to live, kind of how I like to think about medicine. I realize that family med is a better fit for me. And I think a lot of people come in thinking, oh, I'm going to do this, and then once they get into medicine, start really shadowing start learning about whatever they think they want to do, that can change a lot.
What were, oh, go ahead.
Yeah.
So like you said you were trying to do the accelerated like programs.
Mhm.
Is that like part of the like I'm sure you're probably looking into like loan repayment stuff? Like
Okay. Actually,
I've
no.
heard a lot about like with Nebraska there's like a lot of loan repayment stuff in that school.
Okay, there is. So I actually have, I can't even think of the actual proper name for it, but I applied to do the rural health loan for med school. So it's basically an application you do if you promise to go back to a need-based area in Nebraska when you're done, and they give you, I think I got like 20 grand a year to do it, and you go practice for a year. I did hear last year they didn't give any of those out, they only renewed people who were already on it. But there also is the same program for when you're done. So when you're done, and if you're in primary care, which is typically considered like peds, OB-GYN, surgery, family med, internal med, and I think psych might even count. If you go to what they call a need-based area, which really in Nebraska is pretty open, they will give you money back to pay. And also I've heard a lot of things about just hospitals you sign with in general will help do loan repayment deals for you when you're done.
Do any of your courses in medical school explain the legality of practicing medicine in, for example, say?
Yes, to an extent. Like I would not say there's not like a specific class that I had that was like, here's all laws, rules, and regulations in your state. But we would talk a little bit, we'd have lectures on like ethics and, the big topics like, abortion and even to an extent birth control rules, like if, you're a provider that doesn't believe in it, like just things like that. You do touch base with all of that. Like I said earlier, I was on the old curriculum at UNMC. They did change it, but I think they still kept all the basic learning the same. It's just different how it's incorporated into the program. But you get more of that in residency wherever you go, I think.
So do you have any classes, or do you ever talk about in class, like anything about health insurance and how that'll affect you as a caregiver?
I mean, we had a basic class of like kind of what health insurance was and like the different types. I think the thing about health insurance right now, this might be a little bit personal of my opinion, is I think it's gonna change so much. Like even if whatever you learn in med school, whenever you get there, it's probably not gonna be the same when you're in residency and when you're out. And that's one thing you're gonna understand when you get to med school is they'll be teaching you stuff and blah, 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 and they'll be like, oh yeah, by the way, these are probably gonna change by the time you hit residency. And so you have to understand it's a constantly changing field too, with health insurance, healthcare screenings, general things like that. And it's, as I'm more with doctors, you kind of learn that you have to kind of follow the insurance's guidelines a little. It's not always, textbook the way things are supposed to be.
Speaking of textbooks, did you buy your textbooks?
So they do a lot of like recommended reading textbooks in med school. I did buy a couple, like for anatomy I bought Netter's Atlas, just because you need a good anatomy atlas. You just really do. Other than that, the way they structured ours was, every teacher had their PowerPoint. And if you listened to their lecture, they gave you pretty much everything you needed to know on basis-wise. So I didn't really buy textbooks. Also, you have resources through the library at UNMC that a lot of the textbooks that they recommend you read are actually available through the library.
how much has technology played like a part in like your medical school like training and like actually being in the field? Whether like your computer and stuff that you use.
You know, I'm not real good at computers, to be honest, but you just need to know how to run a computer. So all of charting anymore is on the computer. So, I mean, we had to have buy our own computers for test, which, you know, pretty much a basic computer. Whatever you have now for school is good enough, really. So you're testing on that, as well as now they don't, when I was in med school, they printed out all our notes. So we had like big old packets of notes. Now they're doing no paper, and so you kind of need some kind of electronic device to have your notes on. I mean, not any more technology than you're not already using for school.
What opportunities for research while in middle school?
Yes. So I did not do research, but a lot of people do research between their first and second year, which I still think they get so much time off yet between what would be your first, second year of med school. And I think you can still do research during that time. Also, when you're a fourth year, you can take a selective and do research. And a lot of people actually will do research during med school. Some will devote time to do it like during normal school week. So it's kind of whatever you want to do and how much time you want to put in it. You can probably find a research project to fit what you want to do.
So UNC has those huge simulation labs now. When did you get to start working with those?
So we really haven't done much with like the cool mannequin robotic things yet. We caught a baby out of one at one point, which the guy didn't even use the motor, he just pushed it out. But you start using the sim labs downstairs, which is like set up like a normal clinic room. So you have pretty much everything you need for a clinic. They do these things called OSCEs, and basically an OSCE is just you going in and doing whatever you need to do with this patient, which is a simulated patient that they pay, and you kind of get tested over it. They start you off small, which like our first OSCE was, one of them was like going and do vital signs, which trust me, as a first year med school student, you're like terrified because you don't know what to expect at these OSCEs. But just kind of, and then they build up. And so the one I just did for internal med was actually, we had a chief complaint, we had some labs maybe, and we had to go in and actually kind of see what's wrong with the patient and kind of, if we thought they might be in serious trouble, know what to do with admitting and the first steps to make sure you could kind of keep them alive long enough to do whatever else you need to do. So you kind of like build up with that, with those simulated labs. They do also like skill nights. So certain kind of groups in med school, like I heard next week they're doing one with the OB-GYN group where they're learning how to put like Mirenas in and Nexplanons and more things about birth control and those options, and kind of doing simulations with those on some of like, I assume some models. I don't actually know, but I just know that's what the email said. So they do things like that, and then there's always like a suture workshop, so you get to learn how to suture and do some stuff like that before you actually start rotations. Some of you, when we got to the point where we actually went out to the community and did some, they call preceptorships. Depending on the comfort level of your preceptor, you may or may not get to do things like sutures and splinting and things like that.
So you're on rotations right now, right?
Mhm.
How long are each rotations? And I guess that's just it.
So for right now, like my year, I think they're getting back to the same schedule, but so you do semesters, and like internal med is your longest rotation, and it's 12 weeks, and it's paired with psych and OB-GYN, which are both 6 weeks apart. And then this semester that I'm on now is family med, surgery, and pediatrics, and they're all 8 weeks. And so it started beginning of July and I'll end of June. So you apply your third year in this lottery-based system to get your general layout of your schedule. And so you pick like, what I did is I wanted psych first, OB-GYN, internal, family, surgery, peds. That's the order I wanted. And then you put it into a lottery system and you rank a whole bunch of different orders. And then hopefully you get one of your top few choices. I got lucky and got my first choice. And then some of them you can actually choose to go off-site, like Family Med is pretty much all Enroll Nebraska. And once again, it's kind of like they send out an email once you kind of get set into your specific time frame. And like, okay, here's the open ones, here's PowerPoints to explain what each location's like. Give me your top 3 and I'll let you know what you end up getting. So that's how most of those work.
So can your locations be like wherever, like nationwide, or are they all in Nebraska?
So they're all in Nebraska your third year. And there's only, so peds, family, you can go out of town. Surgery, there's Hastings and Norfolk, you can go out of town to, and then the rest of them are all in Omaha. And then your fourth year, you can actually do away rotations, which most people do in like, if you want to do a certain surgical specialty. Like let's say you want to do orthopedics, you might do orthopedics and go to anywhere else in the country, basically. Probably somewhere you might want to apply to residency or two. So you can do that your fourth year.
So when you do that, do you work only at like one hospital or one clinic, or do you move throughout like the town that you're in to the different clinics?
Are you talking about like now on Family Med? Oh, so yeah, in Grand Island, I'm only with family practice in Grand Island. So I'm working with the doctors there. The way they do it is they kind of rotate the med student around. So you can see like how everybody individually does their own practice because they're all private practice there. And then, you only go to St. Francis because that's the only hospital there right now.
So during the rotations, is there any coursework, say, like that, or is it all just
There are still exams. You will learn, you will not get away from test. So kind of the layout of how most of them are is you have lectures once a week yet. You may have some extra things you have to do, like for Family Med, we have to do a home visit, we have to do a community project, and then you do, because everybody's away, they don't make us actually go to lectures, they do these online lecture things we have to complete. And then at the very end of your rotation, you have a shelf exam, which is kind of a nationally based exam, and you take it, and you want to do well on those, so you do well on the rotation itself. And then some of the rotations have an OSCE at the end, which is another test.
You like took the MCAT still being on up, correct? Do you have any like pointers or recommendations on that, or?
I mean, don't freak out about it. I took it here. I'm gonna be honest with you, like UNK, I took step 1 of my boards here too, just because it's only a 6 computer room, and so it's so easy to just zone out, and like you don't have all these other people when you get up for breaks, so it's kind of a nice place to take it. I actually didn't study a ton for my MCAT, but I bought like one of those review books and just studied a little from there, and just kind of went through that book and then took the test.
So for like our hockey, do you know now what the average score is, and like, did you have to try to, like, did you have to get a certain score for that?
So when I took it, it was on the different scoring system. So we only had to get a 24 to get into med school, which is, I think, supposed to be the average score, which is, I don't even,
Like a bicycle.
yeah, I think that's where the cutoff is now for like RHOP, KHOP, but I do not know the actual answer to that.
during your
med where everybody goes off. For me, I'm actually staying with my parents, so it's nice. You know, mom takes care of my dog when I'm not around. But so for family med, a lot of people will, if they're from small town Nebraska, will try to go home or go where their grandparents live or whatever, and then you stay there. But a lot of sites actually have housing. One of my friends is in Aurora currently, and they put her up in like a kind of like a little apartment type thing in the physical therapy building out there. Some places actually have houses they put students in. So it kind of depends on where you go, but most places will have housing if you're going to an off-site rotation. In Omaha, you might be expected to commute some. I live pretty much like right by the med center, and so when I did rotations at the VA, I would drive to the VA. There was a couple times, I don't know if you guys are familiar with Village Point. It's like a shopping center way out west of. They have a UNMC facility out there, so when I did some clinic time out there, you know, I had to commute there, but for the most part, you're not really going to be commuting too far. Any other questions?
Seeing none, let's just thank Katie for her time.